The number of people in Massachusetts who have tested positive for coronavirus have more than doubled on Sunday to 28. Taylor Knight is live with two local doctors to discuss what we need to know about this virus here in Western Massachusetts.
All this week, 22 News is working for you, bringing you the facts about the coronavirus. This morning, we are joined by Dr. Robert Roos, Chief Medical Officer at Mercy Medical Center, and Dr. Esteban Garcia, Chief Medical Officer at Cooley Dickinson Hospital. Thank you both so much for being here. I want to start off talking about the face masks that everyone's wearing. Is this necessary, and is it helping at all?
So it is helpful if you are ill. So if you believe that you have an upper respiratory infection, you're coughing and sneezing, then it's helpful to protect others from that infection. So you're helping to protect your neighbor and your children. It's different if you think it's going to protect you from coronavirus. If you're healthy, it really is not helping in any way. There's lots of gaps all around it. It's not airtight, and they get wet and you have to change them, and it's a false sense of security. So they really aren't helpful to protect you when you're just out in the community.
So you don't suggest going out and buying these face masks right now? They're flying off the shelf right now.
No, I don't. I think it's really important, in a situation like this, that we are also mindful of each other. As a community, we are dealing with this coronavirus together. And if somebody's hoarding supplies or necessary materials, and so not allowing somebody else to have what they might need for their basic needs or to prepare for their own family or children, well, then that can have a downstream impact and affect all of us as well.
So you both work at hospitals. Does your hospital have the test kits right now?
We don't, and they're not, at least in this state, they're not routinely available at individual hospitals. We are required by the state to have approval to have testing at this point. We need to change that. We feel that it would be for surveillance and to understand how widespread COVID-19 is in the community. We have to have access to more rapid testing.
So you don't have the test kits either?
No, they're not available at any particular hospital in Massachusetts at this point. I will say that we are working on it and developing relationships with labs so that as soon as we're able to, we will be able to test. As Dr. Garcia mentioned, one of our best weapons against a pandemic is information, and we need to be able to have the information about who tests positive so we can continue to assess and monitor and treat accordingly. So
tell me about the process if someone comes into the hospital right now. You send the tests out. Tell me about that.
Correct. So now it really is up to the individual patient and their provider to determine whether or not the state is going to allow them to be tested. So if you feel that you're ill, your physician or provider feels that you're ill and could be COVID based on travel or some other issue, then the state will direct them to a healthcare facility for testing. There is some potential that patients could be tested at home, but we're not doing that yet and widespread. So they would need to come into a facility. We would take a sample, a couple of samples, and then those samples would be picked up by the state, once approved, picked up by the state and tested at the state lab. The turnaround is expected to be about 24 hours or so, but the state lab, I believe, is on the other side of the state, so it does take us a little while to get the test there.
Got to get them all the way over there.
That's right.
It's not really a scary test, is it?
No. Okay. No, this is a test very similar to being tested for influenza or other respiratory viruses. A provider can take a swab of the nasal area and or of the oral pharynx as well. How
else are the hospitals preparing?
Well, I think what we're concerned about is if this becomes more widespread, community spread, the concern is that patients are just going to come to the hospital, and because they feel like they need to get care someplace. That's certainly possible. We saw it with H1N1 in many places where hospitals were overrun with really well patients, but that were concerned. So we need to prepare for that. We have been preparing for that. Cooley Dickinson is part of a bigger system. We're part of partners, and our parent is Mass General, and so we are on calls daily with the bigger system to help understand what we need to be doing locally to prepare, and then we're all working, as Mercy is as well, on their surge plans. What happens if you have 30 or 40 or 50 patients that come in that they need to be tested, and more significantly that they need to be treated, because a certain percentage, maybe up to 15–16% of patients will need to be admitted, potentially have severe illness and need to be treated.
All right, thank you both so much. Still ahead in just about 10 minutes, we will have much more with Dr. Roos and Dr. Garcia about the coronavirus and what you need to know about it. Rich, I'll send it back to you now.